I think healthcare needed a push. I think adoption of electronic systems was lacking. I think vendors didn't see the financial markets there like in other industries, and so we're scared to move and commit resources into those areas. And I think that maybe one of the single biggest achievements is it pushed healthcare to move forward with initiatives they probably normally wouldn't have. And by getting this data electronic, I think it's going to drive a whole wealth of knowledge and action into the industry by using that data. On paper, data is not actionable. It was all chart audits, it's all manual. And I guess what we used to say at Denver Health is that if you audit it for 17 years, you can actually find out what's going on in your business. But with electronics, you can actually bring that data to the front. And so if you couple what we're doing with EMRs with data analytics on the backside, I think it's really going to push the industry ahead. I don't think we really anticipated the impact to public safety net hospitals and what the reimbursement changes would really be like. I don't know if you know, but public health hospitals really have been reimbursed in some respect for uninsured care. There's disproportionate share payments and things like that from the federal government, which are going to be phased out as these new laws take effect. And what the impact of that is really going to be on public institutions, because not everybody's going to be insured, and I think that's pretty common knowledge. And someone still has to pay the way. And also higher deductible health plans. I don't think we understood the impact of what that's really going to do to hospitals. Someone still has to pay the deductible, and if the patient doesn't pay that, then who's left? And who's left is the hospital or the provider. And they're going to have to eat those costs. And $5,000 deductible, $10,000 deductible doesn't sound bad if it's one time, but what if it's 50,000 times? And then that's a lot of money that hospitals will have to front in order to have the privilege of treating the patients that they're there to treat. Health IT has been always very supported at Denver Health. We've been investing for more than a decade in health IT. We were early adopters of physician order entry, electronic physician order entry, barcoding at the bedside, all about safety and quality at Denver Health. So we used health IT as initiatives to drive safety and quality into the business. And I think the reason we did that is because we believe that when you come to a hospital, your expectation is safe, quality care. Not that you demand it, it's that you expect it. It's kind of like when you go to a mechanic to get your car fixed. You expect that they are competent in what they do and they're going to fix your car. When you go to the doctor, you expect they're competent in what they do and you're not going to get worse than you were. And granted, when you go to the hospital, it's not a great experience. I mean, it hurts before it gets better. But it should get better, and that should be your expectation. And so if technology can help in any way to provide tools to the physician to give them greater information to treat the broad range of variables that are needed for patients, then I think it's a win. If technology can't do that, or can't do it in a way that's efficient for the physicians, then I think we lose. And I think we're right in the middle of that paradigm right now. It's a good list to be on because it's a good benchmark for you about where you are in the industry. But it's not the only thing. And we don't really measure ourselves by awards more than what the award can mean for self-improvement. So we actually submit for these awards so that we can get look-backs from the people that are giving these awards, maybe like the Davies Award or things like that, where they come in to audit you, and we use that information for self-improvement. And that's really why we do it. We don't do it for the award itself. We do it for the ability to get better.